That constant fatigue, where your battery never fully charges, is a real problem for many men. A potential fix, TRT, comes with a big price in Australia, up to $2,600 per year. So why even think about it? Because the symptoms it hits, fatigue, low libido, mood swings, can ruin your quality of life. The objective is to return your testosterone to a healthy range and help you feel like yourself again. We'll now break down the entire Australian TRT process, the costs, the blood work, and exactly what to expect. First, TRT is legal in Australia, but it's not a simple purchase. It's a regulated medical treatment needing a doctor's prescription. To qualify, a doctor confirms your eligibility based on three things: your medical history, your symptoms, and blood tests showing low testosterone. About that cost, don't expect your insurance to cover it. You must check with your provider as many plans exclude TRT. Treatment is personalized. It can be given through injections, topical gels, or patches, each with unique protocols and costs. This is a long-term commitment. Plan for follow-up appointments roughly every 8 weeks to monitor your progress and adjust the dose, so you have the symptoms and get the commitment. The absolute first medical step is blood work. But what does that really mean? Why are the blood tests so extensive? It's not just to check your testosterone level. Doctors need a full health picture before treatment. They check kidney and liver function and analyze lipids and glucose to assess cardiovascular risk. This isn't just a hurdle, it's a safety protocol. This data creates a baseline to track changes on therapy, protecting your long-term health. Why the caution? Starting TRT signals your body to halt its own testosterone production. This can create dependency, making it a serious decision. This natural production shutdown is why those 8-week follow-ups are so vital. Your doctor must keep your levels optimized since your body isn't self-regulating. After screening and finding a stable protocol, what changes can you actually expect to see and feel? The main reported benefits are what you came for: better energy levels, a more stable mood, and higher quality sleep. Physically, many men report increased muscle mass and improved sexual function. Cognitively, you might notice better memory and concentration. A key long-term benefit is higher bone density, which lowers the risk of osteoporosis and fractures in later life. That extensive blood work we talked about. It's the key that unlocks these benefits safely and effectively. But it's not all positive. To make an informed decision, you must understand the potential risks and side effects. This is critical for men planning a family. TRT can significantly affect fertility. About 65% of men on TRT stop producing sperm in 4 to 6 months. This effect is often reversible, but not always. If you plan on having children, discussing sperm preservation before starting TRT is non-negotiable. Another side effect is hormonal imbalance. Your body can convert extra testosterone into estrogen, causing water retention or joint pain. TRT raises red blood cell production, which can thicken your blood, a condition called polycythemia. This elevates the risk of blood clots. What about prostate cancer? TRT does not cause it, but if you have a pre-existing cancer, it can speed its growth. Regular screening is vital. Remember that initial blood work? It's not a one-time thing. Ongoing tests for red blood cells are how doctors manage the polycythemia risk, so the full picture appears. You're weighing the annual cost and serious biological risks against the potential for life-changing well-being. Those 8-week follow-ups are your main tool for managing side effects like high estrogen. This is where your doctor fine-tunes your dosage. Considering this entire picture, the process, price, promise, and risks, what is the final verdict? Is TRT the right path for you? In Australia, TRT is a highly regulated personal medical treatment, not a quick fix. It demands commitment, money, and careful management. The decision to start is a pledge to proactively manage your health, balancing significant benefits with real, manageable risks. Your first and most vital step is not to self-diagnose online. It's to have an open conversation with your GP or a men's health specialist. Talk to them about your symptoms, discuss your health history, and ask if an initial blood test is the correct next step for you.